I'm Dr. Amy Taneja, Director of Medical Affairs at Organon and a board-certified OBGYN.
And I'm Dr. Christine Greves, a board-certified OBGYN. In partnership with Organon, Dr. Taneja and I are talking about one of the most common complications of birth, postpartum hemorrhage, or abnormal postpartum uterine bleeding.
Postpartum hemorrhage, or PPH, is the leading cause of maternal mortality worldwide. It is estimated that about 14 million women experience PPH globally every year, and every 6 minutes a woman dies from PPH. And over the past 10 to 15 years, the rates of PPH at the time of delivery across the United States continue to rise.
Recognize that PPH is indeed a serious concern and affects maternal morbidity and mortality.
And I think that that's really what needs to hit home here. Despite all of this knowledge, despite all of this, we still have not moved the needle. Many times, patients who experience a postpartum hemorrhage or an abnormal uterine bleed don't necessarily have risk factors when they walk in the door. Dr. Greves, what's top of mind for you in your practice regarding a diagnosis of PPH?
2 key things. Recognize it early. And the other is knowing you need to recognize it early because you need to intervene quickly in order to have effective management. Why? Because significant blood loss can occur. And a lot of patients do not have any identified risk factors. So being able to diagnose it and effectively initiate treatment to manage this blood loss is of utmost importance.
Can you speak to the mental health component of PPH? I feel like that's often overlooked.
It absolutely is. It can have long-term implications, in fact. The reason it can have long-term implications is because it not only affects your body, so not just physically, it can also affect you mentally and can affect you financially. For example, women who have postpartum hemorrhage are more likely to develop depression. And it's not just the mom who has adverse effects from this PPH. Some people, when they're living through it, they have flashbacks and can remember this experience, resulting in the fear for the entire family to have another baby. This further reinforces that you need quality postpartum care, just like you need quality labor and delivery care.
Dr. Greves, how do you approach diagnosing PPH?
Diagnosis really depends on the patient. There are some risk factors like anemia, hypertension, a previous cesarean, and age that can increase the likelihood of PPH, but it can happen to anyone. PPH can be unpredictable, so careful evaluation and ongoing reassessment of all patients are important when it comes to diagnosing and delivering prompt treatment.